Welcome back. Hundreds of thousands of Arizonans will face higher health care costs beginning next year after Republicans and Democrats in Congress were unable to come to an agreement over the Affordable Care Act coverage.
12 News journalist Joe Dana shows us how one Valley family will be affected and what options they have. Joe?
About 423,000 Arizonans are on the ACA marketplace plans, also known as Obamacare. Arizonans on these plans have been notified that in most cases their monthly premiums are going up. One recent nonpartisan study says an average of 300%. In the case of one family, if premiums aren't going up, they're still losing vital coverage.
We are literally hoping and praying that we can get some sort of continuation of care or some sort of exception.
The new year is usually a time of hope, but for Steve Gomez and his family, it only brings questions. Steve's son Anthony was born needing a heart transplant and has complex medical needs. The Gilbert couple are business owners and get health care through an Obamacare marketplace plan under Blue Cross Blue Shield of Arizona. They also get help from Medicaid. Blue Cross recently notified Steve the federal government's reduction or elimination of subsidies would change his options in 2026. Steve says the only plan that works for their family next year actually has lower monthly premiums, but their son's doctors are no longer covered.
Basically, we're going to pay $2,200 a month to pay for nothing. The way it looks right now, to pay for all of our care out of pocket.
That could run upwards of $100,000. As a longtime advocate of Obamacare, once featured at the Democrat National Convention because of the care his son receives, Steve worries now about the program's demise. Something recently echoed by Arizona Senator Mark Kelly, who has accused Republican colleagues of refusing to have meaningful negotiations over extending ACA subsidies.
In Arizona, many older adults and working families rely on marketplace coverage for insurance. These are real people.
GOP leaders say they want the funds passed during COVID to end this year as scheduled. Others say they're open to a temporary extension. 4 Republican House members teamed up with Democrats to force a vote to extend ACA funds. That vote is expected next week. But some Republican senators tell NBC News the House bill will be dead on arrival in the Senate. In the meantime, Gomez is asking his Congressman, Republican Andy Biggs, to offer a solution for Arizonans like him.
Families like ours that have medically complex kids live in your district. Step out of your own bubble and see the needs of your constituents, see the needs of other Arizonas. People are struggling.
A spokesperson for Congressman Biggs calls the program the Unaffordable Care Act, saying Biggs has proposed alternatives to Obamacare and, quote, the congressman will continue to offer up market-based solutions and reforms, but shoveling billions more of taxpayer dollars into a broken system without substantive changes will only lead to more suffering and frustration for Arizonans. Blue Cross Blue Shield tells us they are trying to help families work through options and that, quote, ACA customers nationwide are facing complicated changes in 2026. Back to you.
All right.